In this video, we're going to cover chapter 1, experimental, or the last bit of chapter 1, which is going to be on experimental design. And the first thing I want us to start off with here are a few bits of terminology. So the first thing is experimental units are the individuals that are studied, and these individuals may be people, plants, things, animals. But when they are people, sometimes we will call those experimental units subjects. And the big difference here, again, between observational studies and experiments is that in an experiment, we actually apply a treatment to the subjects. And so I want us to take a look at an example here. So, treatments and experimental units are what we're going to try to identify in this study. And so, to investigate whether it helps smokers to quit smoking if they take antidepressants, one study used 429 men and women who were 18 or older and had smoked 15 cigarettes or more per day for the previous year. The subjects were highly motivated to quit and in good health. They were assigned to one of two groups. One group took 300 milligrams daily of bupropion, an antidepressant. The other group did not take an antidepressant. At the end of the year, the study observed whether each subject had successfully abstained from smoking or had relapsed. And then, of course, we would want to compare the results for these two groups. So the question is, what are the experimental units? So essentially, what is the group that we are applying the treatments to? Okay? And that is the 429 volunteers who are the study subjects. And then, second, what are the treatments? And so the treatments here, okay, are whether they received bupropion or not. Okay. And so it actually ends up that this is not the only study that's been done on whether antidepressants help people quit smoking. And based on a recent meta analysis, okay, it does seem like it helps people quit smoking. Okay? And all a meta analysis is it's a study of studies. Okay? So this meta analysis that I'm talking about here um, is collecting information from 124 studies, which included 48,832 participants. Okay? So you can kind of think about it as a really big study. Okay? All right, so a little more terminology. Okay, so we have our response variable, which is the variable that just simply responds to the treatment. Okay. A factor is a variable that the experimenter controls so that we can determine its effects on the response variable. Okay. And then lastly, this last one's actually not a definition, it's just a statement of fact, which is if an experiment has several factors, a treatment is a combination of specific levels of each factor. Okay. So before we introduce multiple factors here, let's just start off by creating maybe levels in the previous experiment that we were looking at. So if we wanted to, rather than just giving people 300 milligrams of bupropion or not, okay, we could instead have one group that doesn't receive the antidepressant, okay, another group that receives 100 milligrams of the antidepressant, another group that receives 200 milligrams, and then maybe lastly a third group that receives 300 milligrams. Okay. So those would be the different levels of the treatment. Now, some experiments might include multiple factors. So we might have people not only taking different levels of um, the antidepressant, but maybe we also want to see how maybe exercise affects whether people are able to abstain from smoking or not. So we might have several groups here now, and each group is going to be assigned a different level of those two factors. So, for instance, one group might exercise 3 times a week for half an hour while also taking 100 milligrams of the antidepressant. All right. Well, let's keep talking about this study and try to identify the factors. So remember, the factors are. Let's go back and actually look. Right. The factor is the variable that the experimenter controls. Okay. So what do we have control of here? And that is whether the subject received the antidepressant or not. And then what is the response variable? Okay. Well, we want to know what the factor we what the factor is affecting. Okay. And we believe it's affecting whether or not each subject was able to quit smoking or not. And then next, what should a good experiment do? Well, for one, we don't just want to give the subjects a treatment. We need to have something to compare to. Okay. Sometimes we're just comparing to another treatment. For instance, maybe we just want to know, is this new medication more effective than the previous? Okay. But also sometimes maybe we want a control group, so a group that just simply doesn't receive um, maybe the medication that we're talking about here. So we can see if this medication is more effective than taking no medication. And then lastly, we do have to watch out for the placebo effect. So sometimes is what we'll do is we'll have a group that thinks they're receiving the medication, but in fact are not. And we're going to talk a little bit more about the placebo effect in the next couple slides. So, aside from needing some group to compare to, we also want to randomly assign subjects to the treatments. The fear is that if they choose their treatment, that we may end up with um, two groups that differ maybe a little bit or maybe a lot. Okay, maybe people choose certain treatments, or the people that choose a certain treatment are different than people that choose maybe some other one. And then lastly, replication. This just means we want to study more than just one individual. Okay, we would like to have many people in our study. Okay. So this here is again going to be about the placebo effect once we get to the end of it. But there was this treatment that was called gastric freezing, um, and it eventually was abandoned. Okay. But is what they would do is they would essentially put a balloon down somebody's throat and into their stomach and pump really cold liquid through that balloon. Okay. And actually, a pretty decent proportion of people um, felt like they had relief from their pain from their ulcers. Okay. And so, yeah, this was at one point widely used. Okay. And is what the issue is that the original study, which I have the link to at the bottom, is there was no control group. Okay. And so it ends up that they did some studies later on where they did have a control group. And so one group um, ended up with this very cold fluid flowing through that balloon, while the other group, um, it wasn't as cold. Okay. And it is what they found is that it wasn't actually that coldness that was making people feel better. In fact, they believe it was the placebo effect that was causing people to feel better. Okay. And is what we can see down here is that in those two groups, 28 of the 82 patients subjected to gastric freezing improved, while 30 of the 78 patients in the control group, okay, and really it's a placebo group here, okay, they weren't just a regular control group, they were actually receiving the treatment but with a warmer fluid pumping through there. Okay. And so actually, it looks like more people in the control group found improvement. Okay. And again, this eventually was abandoned. Okay. And that might explain why you've never heard of this treatment before. Okay. And the key takeaway is really important to have a control group. Right. And then we have our placebo effect a little more on it. Right. So one thing is it's not really that well understood. Okay. In that the placebo effect can, not in all cases, but with some treatments, it's been found that up to 35% of people found improvement based on just having the placebo. Okay. It's a pretty large proportion. And so that's why it's really important to have a placebo group if we think the placebo effect um, may confound our results. And then lastly, there is actually something also called the nocebo. So if you tell somebody that they are doing something that's bad for their health, they may actually get worse. Yeah. So is what we're trying to do when we have a placebo is we're trying to avoid bias because again, if those people think they're being treated, they might just simply feel better based on the placebo effect. Okay. And when we do give people a placebo, they do need to be actually informed that they may be receiving the actual treatment or they may be receiving the placebo. Okay. And in the case where it's just the subject that is unaware of whether they have the true treatment or the sham treatment, we call this a single blind study. But sometimes we're worried that maybe the people evaluating the subjects um, may end up having a bias as well. Okay. This could be just simply a vested interest, but more likely, it's actually going to be an unintentional bias in that maybe they might treat certain subjects differently because they know what treatment they had. Okay. And again, this could be done unintentionally, but again, could mess up our results. Okay. So sometimes we'll have a double blind study. Okay. And it doesn't mean that no one knows what treatment these people are receiving. It just means that there's some third party that's keeping track of what subjects received what treatment. Okay. All right. And then we have a design issue here on this slide, lack of realism. Okay. And I think I want to start off with the bottom one here with the mice. So it was found that a certain species of mice, when given high levels of saccharin, were developing bladder cancer. Okay. And this ended up leading to saccharin being listed as a carcinogen. Okay. But later studies with different species of mice and different animals were not able to replicate these results. It ended up that this species of mice metabolized the saccharin differently, and this was the cause for these results. Okay. And so after this, after these findings, saccharin was delisted in 2000. Okay. And so the point here is that a study on lab rats or mice or whatever it might be, okay, it may not transfer to humans. Okay. And we're going to look at another example up above where we have something similar going on. Okay, but I'm going to phrase it in a question. It says, "Is studying the effects of eating red meat on cholesterol values in a group of middle aged men a realistic way to study factors affecting heart disease in humans?" Okay. And so, of course, the answer here is no. If we want to know um, about heart disease in humans, we shouldn't just study men. Okay, we should study women too. Okay, but it ended up in the '60s that there was this medication um, called thalidomide. Okay, and many pregnant women, okay, ended up, well, their children ended up having birth defects, and some of the babies actually ended up dying. Okay, and so this was quite the tragedy. Okay, and so a law ended up getting passed um, to ensure that um, women, especially pregnant women specifically, didn't end up in studies. Okay. Or I should be a little more clear, didn't end up in phase 1 and phase 2 clinical trials. Okay. But this ended up being used more broadly. Okay. They ended up excluding premenopausal women from almost all phase 1 and phase 2 clinical trials, meaning that most of our data was just simply on men. So this had an unintended consequence. Okay, with certain diseases, we knew how they affected men, but not so much how they affected women. And one of those is actually heart disease. Okay? Women experience slightly different symptoms than men. Okay, and specifically, it's um, that chest pain. Men tend to experience much more chest pain than women do with heart disease. So this has been underdiagnosed in women. Okay. And so is what ended up happening is in 93, they passed a law requiring the inclusion of women in clinical research. Okay. So the hope is now that this is less of an issue, but it sounds like it still is an issue in medical research. All right, and then I'm going to have us look at 3 different types of experimental design. Okay, so the first type is just a completely randomized experimental design. This is exactly what we had when we were looking at the smoking experiment. Okay, you have your subjects, you randomly assign them to a treatment. Okay, and then in the end, we compare how those 2 treatments affected the subjects or experimental units. Okay? So this is kind of the most basic design. Okay? Now, when we're maybe talking about heart health or heart disease in humans, it might be a good idea to use something that we call a block design. So we maybe have 2 groups, or maybe more than 2 groups, that have some similarity, and we want to kind of study these groups separately. And so here, again, we've blocked off men and blocked off women. Okay. Or you can think about this as a strata. We have a strata of men, a strata of women. Okay. And so the men will be randomly assigned the 3 therapies or 3 treatments. Okay. And it doesn't have to be 3. That's just what I have in this diagram here. And the women are also assigned to those 3 therapies or treatments. Okay. And then in the end, we will look at how those therapies affected the women or treatments. And similarly, we'll look at how these therapies or treatments affected the men, because maybe some of these therapies or treatments might be more effective for the men, some of them might be more effective for the women. All right. And then the last one we're going to look at is match pairs, which can be done actually in a few ways. The most interesting one probably are match pair design on twins. Okay. Because they are so similar, um, they make a perfect pair for match pairs design. You can give one twin a treatment and the other twin maybe the absence of the treatment, and compare the results in the end. Okay. And now we wouldn't just do this with one pair of twins. We'd have several pairs of twins that we would do this with. Okay. But they don't have to be twins. We could design our pairs to be people of similar age and similar health. Okay. Or maybe similar or the same gender and the same age. Okay. And again, we could give one of them the treatment and then one maybe the placebo or no treatment at all. But there is another way. We can actually still perform match pairs design on individuals. Okay, we don't have to pair them. Okay, so in fact, the pairs are going to come from the individuals themselves. So we may in some cases, we might give somebody a treatment and then see how that affected them. Okay. And take some time off in between and then give them the new treatment and see what the effects were. Okay. So that would be constitute also match pairs. All right. And so I have an example here of exactly what we were just saying if you want to go and read that. Right. And so is what I want us to do is try to identify which experimental design is used in these three examples. So is there a significant difference in resting pulse rates for men and for women? A random sample of 28 men and 24 women had their pulse rates measured at rest in the lab. Okay. So this is that block design, right? We're stratifying our group. We're breaking them into men and women. All right. And then the second one here. Okay. Many dairy cows now receive injections of BST, a hormone intended to spur greater milk production. The milk production of 60 dairy cows was recorded before and after they received a first injection of BST. Okay. So this is that match pairs. Okay. The pair is for each cow measuring their milk production before BST and then after. And then lastly, it says in a study of sickle cell anemia, 150 patients were given the drug hydroxyurea, and 150 were given a placebo. Okay. The researchers counted the episodes of pain in each subject at the end of the study. Okay. So there's no match pairs going on here. We're not pairing people. Okay. We're not stratifying, breaking them between men and women, or breaking them from into age groups or anything like that. Okay, so this is just that completely randomized experiment. And as I'm looking up at that very first example, okay, my question here is: did we actually assign a treatment? Okay, so that top one up there, well, we did stratify the group. This is actually not an experiment. Okay, that one up there is actually an observational study because no treatment was applied. So I would actually erase our answer there, stratified block design, and say that's actually an observational study. Okay. Right. And the last thing I want to talk about here are ethics. Okay. So it's important to think about what rights humans, animals, and ecosystems have. Okay. Um, but there are some other interesting questions that we might have. Okay. For instance, when is it okay or not okay to include a placebo group? Okay. For instance, maybe we have some people that are near death. Okay. And we don't want to give them a placebo. We want to give them a treatment that actually gives them a chance of surviving. Okay. Um, unless, of course, we maybe have informed consent. Yeah. Right. And again, we should always have informed consent when an experiment is involved. Okay. And then another one, when should an experiment be interrupted? Okay. And so a good example here of an experiment that should have been interrupted and actually had multiple ethical issues is, and it is a horrible experiment, is the Tuskegee experiment. Okay. So the study initially involved 600 black men, 399 with syphilis, and 201 who did not have the disease. Participants' informed consent was not collected, so that's a rule broken there. Researchers told the men they were being treated for bad blood, so they weren't actually told that they had syphilis. Um, a local term, and so bad blood was a local term used to describe several ailments, including syphilis, anemia, and fatigue. Okay. Now, this experiment went on from 1932 to 1972. Okay. Um, here's where the really horrible part happens: is in 1947, syphilis becomes the in 1947, penicillin became the recommended treatment for syphilis. So from 1947 to 1972, these subjects were not actually given penicillin. They were just left to suffer with syphilis. Okay. And by the time by that time, 28 participants had perished from syphilis. 100 more had passed away from related complications. At least 40 spouses had been diagnosed with it, and the disease had been passed to 19 children at birth. So, yeah, this is an example of an experiment that absolutely should have been stopped, and these people should have been treated with penicillin in 1947. Um, Again, rather than letting them suffer through to 1972. And then lastly, we actually have committees called institutional review boards, and every college has one. Okay. At least every college performing research has an institutional review board, and their job is to, of course, ensure safety. That's the obvious one, safety and ethics. Okay. But the less obvious ones, maybe here, are they also want to protect people's privacy and data. Okay. Um, and they also want to ensure that the subjects are given informed consent. Okay. So when you do have a study or experiment you want to perform, if it has any chances of causing ethical issues, it's going to have to be ran through the institutional review board. All right, and that actually wraps up um, chapter 1.